going to invite His Excellency Honorable Dr. Adrian Daisley to come and share on mental health and climate change. Over to you, Dr. Daisley.
Thank you so very much. You're a great host, and you know, poor mental health affects us through something that is very common, the climate. And as we traverse our society, we realize that in everything that we do, we have to take into account mental health, because you know, it can make it very difficult for individuals to function in society, causing a ripple effect in the development of our great, beautiful planet. There's growing concern that mental health is being exacerbated by climate change. What do I mean? Well, when persons, generally in the past, persons who heard there was a storm coming or there was a hurricane coming, prepared themselves best that they could, but didn't have the added pressure of what if this is the moment where my house would be swept away, or where I would lose my life's savings. And it has shown us that mental health has now been impacted by external factors, not just internal factors as it relates to behavior, but external factors as it relates to our climate. And we need to make it clear that we cannot sit back and be quiet about something as uncontrolled as the climate impacting something that is in control, our behavior. And so we must move the conversation to a place where we can have an international dialogue. This is why this climate conference is so important, because what it really is doing, what it really is doing is highlighting the importance of non-governmental, governmental, interregional, and international organizations coming together and ask themselves the hard questions of how can we mitigate climate change, impacting and bringing about better mental health in our society. You know, most of the literature focuses on what is going on in small, faraway places like Indonesia and Asia. But we've seen an uptake of climate change in Africa, and we've seen an uptake in climate-related disasters in the Caribbean as well. And based on this, you know, qualitative analysis, we can see that the barriers to our mental health are being broken down by these external factors that we call climate change. This is going to have, you know, an impact on our economic development, our labor market, as well as, you know, on trade and policy. We can't say it doesn't affect us, because we can see that it affects each and every one of us. Climate change isn't something that is going away. It isn't a problem that if we ignore it, is not going to affect us, because we have already begun to see the effects of climate change within our region. And, excuse me, really not feeling well, guys. Apologies. Globally speaking, you know, we have experiences where people are experiencing a higher level of stress when they are feeling as though there's going to be a climate crisis coming on. When persons turn on the television in the years gone by, they knew a storm was coming. Let's prepare, just get some wood, you know, border our homes. But now people are being seen for stress, post-traumatic stress, as well as pre-stress, when they feel as though there is something happening that they do not or cannot or they have the perception that they can't control. And we know that stress is a malfunction in our capacity to understand whether or not we have the wherewithal to manage the situation that's outside of us. You know, depression and anxiety, behavior disorders are also being impacted by climate change. And the suicide rate has gone up. For those who might be following this dialogue today, and the consequences of this has a significant impact on our society. We cannot sit back and not open our eyes to what is happening around us. Also, we have developing fields that are being impacted. You know, farmers can no longer say, well, when I can look forward to taking care of my family. And this impacts on the ability of income, which is going to impact on the ability to buy and sell and produce. And so we need to find a way to have early identification within our system of how to mitigate these situations. And if we talk about climate change, we have to talk about COVID. And we have to talk about COVID because what COVID really did is that COVID punched a hole in our very vulnerable systems around us and showed us, pointed the spotlight on the reality that we weren't ready for major crises. And during COVID, we had many mental health reports. We had individuals feeling as though they cannot cope with what was happening. And so we can no longer, live as if climate change is going to go away. But we also need to bear in mind that both immediate and long-term factors of climate change must be taken into account as it relates to how it affects us and how it affects our minds. We need to get social workers involved, and we need to get the general population involved. We need more programs, training programs that incorporate mental health and climate change. We need to let people know that it's a real thing, that climate change isn't only real, but it is also impacting on our children. Because, when a child is afraid of the weather, that's pretty normal. But when a child is overly afraid of something that they can't see and have this expectation that something is going to come tomorrow that's going to take away their life, their family, then that's cause for concern. As well as we also, as a society, need to look for what opportunities are that are presented within the context of our mental health, and working with service providers to prepare people, prepare each other, because this is not a problem that is for the health services or the mental health services. It's a problem that is a problem. And what barriers can hinder mental health within the context of society is the lack of educational access and healthy information about how climate change can impact us. Larger organizations are beginning to realize that this is not a problem. And you'd hear me repeat this often because, sometimes we come into a conference like this and we just want to share information and data. But based on some lessons that I have experienced quite recently, I have seen that mental health can ravish your business. It can severely impact on marginalized communities and the most vulnerable among us. So how do we provide our people with the opportunities to voice and to be catalysts for change? Well, first of all, we need to realize that mental health affects relationships. Relationships affect workplaces. Climate change affects environments. Environments affect people. People affect each other. And we don't need to have, a really high perspective on the science of climate change. Climate change has been proven by all scientists, including large organizations like the like those organizations that studied climate change. And I believe that we're living in a time where we're going to have severe challenges to our mental health, and climate change must be and can be mitigated. The reality is that we bring a beautiful spin on the fact that climate change can be mitigated, and because it can be mitigated, we can also mitigate its impact on our mental health. And we need to make that linkage between mental health, suicide, and climate change. We need more research and development looking at the reality of who is being affected in our society, how they're being affected, and how we can actually help them. How countries can really begin to implement policies that are not just about bottom dollar and the economy, but about the social fabric of our society, and understanding that if we can help mitigate climate and its impact on our society, we can also mitigate its impact on health. The other thing about climate is that it affects our mental health, but also our physical health, because persons who do not have access to health care in vulnerable communities, when they're impacted by a hurricane or a storm or typhoon, they can't go out to the pharmacy and get medication, and so we can't see this as a problem that is going to go away. And what we need to do is we need to bring our young people in, so that our young people now can help us find resources, and they themselves can also be resources of change within the context of mitigating climate change and our mental health. It means that we need to double our efforts to expand across sectoral demographics. We need to look at infrastructural development and its vulnerability to climate change. We also need to consider, how secure are our hospitals and our schools? And do we really understand that this impacts our building facilities? The climate change impacts our building facilities. And so it isn't, we say in my country, it takes a village to raise a child. And I always say that because this is a village issue. Increasing also digital awareness is very important as well in helping us mitigate climate change and manage the battle that's going on in the minds of our people across digital spaces as well. And within the context, we need to empower our schools, bring climate change education as a part of our curriculum. I think this is very important. And last but not least, we need to utilize technology, use what is available, what reaches the masses, to share the conversation and make the conversation not science, but make the conversation societal, make the conversation something that people can identify with and don't feel that they need to wear a white lab coat in order to understand. Because when a person is impacted and their house is impacted, they don't say, oh, the doctor said to me. They say, well, the hurricane came and took away my livelihood. And, I watch television and I see these issues going on with persons who are being impacted severely by climate change. And my heart breaks for them. It shows us that if it's happening in St. Lucia or if it's happening in Trinidad or Jamaica, it can easily happen in Barbados. And if it's happening in Barbados and the Caribbean, it can happen in Brazil. And if it's happening in Brazil, it can happen in Europe. If it happens in Europe, it can happen in Africa. And we see a lot of it in Africa now. But what used to be a conversation in Asia and Africa is now a conversation in the Caribbean. So we need to move the dialogue to where people are. We need to understand that just because there's a hurricane in the desert doesn't mean there can't be a hurricane in the Caribbean. And and scientists are saying we're going to have more and more impact and effects of climate change. So we need better engagement to help us mitigate climate change. Engagement with our youth, engagement with our non-governmental organizations, governmental organizations, and our policymakers. And with that said, I yield the floor. Thank you so very much.
Thank you, Dr. Daisley. We can mitigate climate change, and if we can mitigate climate change, then we can mitigate the impact, make the conversation societal, so that people can relate to it. Thank you very much, Doctor.